Hi, everybody. On today's 50 Shades of Pain show, we're going to talk about a specific patient who had an injury similar to a whiplash injury that we treated with PRP. So stay tuned and you'll find out more. We're trying something new, so let's see if this works. Nope, and it didn't. Hold on. And we're back. So, healthcare has become a factory that churns out one-size-fits-all solutions with surgery and whitewashes problems with pills. This is our 50 Shades of Pain show. It's one way we at Wellward try to empower patients to take control of their health and feel empowered that they can actually change the course of their health and wellness, particularly when it comes to pain issues. So today we're going to be talking with one of our patients. James, would you like to make the introduction?
Today we're going to be talking with...
We didn't introduce ourselves.
Oh, that should probably help out for you guys who've never met us, you few people out in the internet world. Go ahead.
I'm Dr. Donish. I'm a native Kentuckian and the medical director of Wellward Regenerative Medicine, where we try to help patients live healthier lives and deal with pain issues in a holistic, organic way.
And I'm Dr. Escaloni, physical therapist and movement specialist at Wellward Regenerative Medicine, trying to help people get back on their feet again and move, and especially after regenerative medicine that you can only get here at Wellward Regenerative Medicine.
Yeah. Does everybody see... this way. Does everybody see the logo, the new logo? This is something I worked on over the weekend, so hopefully it's actually working, and we're not just
pointing randomly at the ceiling.
Exactly, or broadcasting to ourselves.
Which has happened once or twice.
Right. So why don't we introduce, or I was going to let you introduce.
Of course. So, because we've had this whiplash series where people have learned all about the qualities, the quantities, all the pathology associated with whiplash, now we're looking at somebody who's gone through all that and then has come out the other side successfully. All right, Professor Allison Connolly, you care to come on in? Yay! All right. Cool.
Yeah, that's all Steve said. It's
all right.
Backwards on the computer, so it's hard to see.
So tell your story. What happened with you?
Goodness, well, I've had neck and back problems for all of my adult life. I'm not exactly sure how they started, but possibly motor vehicle accidents. So I've had a lot of years of treatment, both here and in Europe, and
here being in the U.S.
In the United States and in Europe, and never really got some sustainable healing until I came to Wellward.
Okay, so you've tried things like physical therapy, chiropractic, other things along those lines
I've done physical therapy, chiropractic, osteopathic adjustments, and they all give some relief, and I've had fabulous people helping me, but I needed something that would really stick and that would last longer. So coming to Wellward, I've been able to both do the regenerative treatments with Dr. Donish, and then I've also been able to then work with you and help focus on how to strengthen and really have those treatments last.
All right, wonderful. So let's hear a little bit about the PRP experience.
Yes. So I had PRP probably about 9 or 10 months ago. Mm-hmm. When the COVID-19 pandemic started and my whole life moved in front of Zoom, my neck just felt like it collapsed. So that's when I first started getting some regenerative treatments in my neck. Then with Dr. Donish, we decided that the best thing to do was to really have the potency of the PRP. So I came in one October afternoon, and his staff took my blood, and then a couple hours later went into the procedure room, and Dr. Donish did the injection. So it was intense. I took it easy the next day, but I bounced back really fast.
Yeah, okay. And she's a warrior.
Right. So for you to think about how you were beforehand to how you are now, what's different?
I don't have pain anymore. So I mean, it's just amazing. I feel like I have normal aches and pains that a 40-something-year-old would have. And, you know, the other thing that I've really thought about a lot is that I didn't realize how bad my pain was until I started getting better. So I think that I was just so used to pain and so used to rising above it so that I could teach, so that I could travel, so that I could spend time with my friends. And then once I started getting better, I realized that I was in worse shape than I realized.
Okay.
Yeah.
So how long did it take for you to start to notice some recovery, some improvement?
I felt like I had additional stability within a few days.
Oh.
And then I've always, when I do my yoga in the morning, my neck has always felt and sounded kind of gravelly.
Mm-hmm.
And within 4 or 5 months, that diminished. And it's still there a little bit, not all the time, but something's going on to heal up there. But my neck is strong now. I mean, I don't have, it doesn't feel like there's a bowling ball sitting on top of my neck anymore.
All right.
Yeah, and it was not a very complex issue. It's we'll show on the ultrasound what was going on, but we've talked a lot about fascia and how much fascia holds things together, and when there's any kind of disruption in it, it's like an unzipping effect where now the body doesn't have the ability to use all of the muscles that it's been given, and so it relies heavily on one group or of muscles or joints or ligaments or tendons, and it just overworks those things. So it's more a matter of rebalancing all of those stress loads, and that was very easy to figure out and address in your case.
Yeah, for somebody who's had this type of condition, is this response from PRP pretty typical?
It really is, particularly, I mean, you know, you don't look 40, come on, let's be honest about that. But especially in younger individuals, it has a very robust, rapid response. I mean, within a few days is pretty impressive. It shows that you have a very productive inflammatory system. But even in older individuals, we can get really tremendous traction in a very quick amount of time, especially compared to the alternatives.
Okay, and we know that she had a whiplash injury, but what was her diagnosis prior to all the PRP?
You mean before coming here?
Yeah.
You know, the problem with a lot of pain issues is that they never get a proper diagnosis. So it's just like a generic neck pain or low back pain.
Okay.
And that does nothing. A diagnosis that doesn't really take us to the next step or a treatment plan is a pointless diagnosis. So one of the things that we're really good at in our HEAL methodology, the first step is hearing the message that your body tries to convey with pain and understand specifically what's the underlying cause or what's the underlying specific problem that's causing pain. Once you figure that out, a lot of the other steps become self-evident. I mean, once we know that it's this fascial band or this tendon or this joint being unstable, then what we need to do next becomes very clear.
So how did you figure out which tissue was the problem?
I'll show you.
Great.
Okay.
You wanna
Yes.
lay down?
Okay, that was my cue for you guys, so that at Wellward Regenerative Medicine, and I really hope this logo is actually up there. This is part of the pain mapping process because there's so many things that could be a problem. And if you guys come in and you have some sort of problem with your neck, the mapping out of where that pain is coming from, that's when we're listening to the message. And this is one of the easiest ways that we can get this started. I'm going to get out of the way and reveal this. This is Diagnostic Ultrasound.
Hey James, can you zoom in on the camera?
I will make an attempt.
So it's this right here.
Oh, right here. Okay, perfect, yeah.
Yep.
There's a couple buttons. I'm a very, very good clinician, not a very, very good camera guy.
You're gonna turn this ring and focus that.
There
we go.
Perfect. All right, everybody in internet land.
James,
Dr.
it's
Donish
still a
is
little
gonna-
out of focus. Can you... Oh, missed it. There we go.
Is this good?
A little bit more. Yeah, that's good right there.
Ah, wonderful.
All right.
This is what you guys are seeing at home, and this is what we are seeing as well. Care to narrate?
You can see, if you want to point to what I'm talking about, that would be helpful.
Of course.
So what you're seeing on the ultrasound is multiple layers of tissue. So that first layer is just fat and skin. Everybody's got fat. It's not that you're... The next layer down is one of the muscles. Next one down. That one right there. That's one of the muscles that helps hold our neck up. You can see there that thicker muscle on top, the trapezius muscle. As it comes up, it becomes a thin tendon that then attaches to the top of the head. So I'm looking at it in cross section, and then if I turn the ultrasound, you can see it in a different angle. You see how the muscle is thicker on the right side. You missed your calling, James. You should have been a Vanna White, or there's never been a male Vanna White. That would have been a good calling for you.
I would like to do that.
But you can see how the muscle is thicker because it's thicker at her shoulder. Yep. Can't see you, James.
Yeah.
It's thicker
Shoulder.
up here, and then it thins out as it goes towards the head.
Mm-hmm.
So these fibers right here, if we look very closely at them, hers are all healthy right now, but if we had taken a look or taken some pictures before we ever did anything, you would have seen that some of these fibers were wispy or not really connecting to the top of her head. So it just wasn't holding enough tension across the entirety of her muscles. And so it took a little bit of PRP at those segments. The other, go ahead.
So for the people at home, it's hard to tell, but we've talked about this being good, this being kind of injured, and this is what it actually looks like when we're talking about that. A lot of this stuff that's just continuous, good.
Yeah.
More like this, not so good. And this is generally associated with pain.
And it's really helpful at the anchor side. So let me get a good view of bone. You see how right there's like a dark space right in the middle? That's actually a bone. It's a shadow of a bone. And you can see how all of the muscles coming in attach down into that bone. And those are really common sites for that disruption to take place. Once that disruption takes place, then everything just kind of unravels from there. The other thing that's really easy to see on ultrasound is here's a joint right there. You see that joint line in the center? Yeah, either one of those two, because those are the joints of the neck. And when there's damage to that, you can actually see it, but with swelling around that in some what's called bone spurs, or like segments of bone that have just kind of hardened around where that joint should be. And I think at this point, all of her joints are actually looking pretty darn good. So we have nothing remarkable to show. But I can show you on the X-ray what we're looking at. Not the X-ray, but the spine model. It's we're looking. Yeah. And so essentially, she would be. This is like her spine right here. And what we're looking at is the contour of this space right here. These joints right here, if you can zoom in on that. Ooh, that's pretty, James.
Thank you.
So these joints right here are what we're looking at in cross section. Ooh, well done. Yep, right there. You can see how each of these has a tiny little line in the middle of it. And we're looking at these spaces when we're looking under ultrasound to look for any bone spurs or osteophytes or places where, because of inflammation, it's just hardened up and calcified. If we see anything like that, then we know that segment is unstable, and we need to do some work to help fortify the ligaments and the tendons that hold things together there. So, anything else that you wanted to share from your own personal experience?
I would do it again if I needed to.
James, did you have any other thoughts?
Well, yes, I do. Dr. Danish,
Yes.
how would you know, with all the stuff that we just saw in here, all the squiggly stuff, that is the pain spot versus it's just some random scar that somebody can get without any pain?
It takes some practice to be able to see the snowflakes turn into actual anatomy, but we use our pain mapping process to figure that out. It's not just looking at the ultrasound, but it's also doing the physical examination. James will run through a very thorough examination, and together we kind of think through what are the connections, how to connect all the dots, and figure out, okay, if the pain is here, but the instability is out here, then there's a problem with the connection between these two. A lot of what we want to do is not just address the problem here and now, but also figure out how do we prevent this from happening again. And those connections are really critical. Once we get a good physical examination, then we do some diagnostic injections where under the ultrasound I can actually tease some of these things apart and see if they're holding their integrity or if they're just kind of flailing out there. Once we figure that out, then it becomes very easy to figure out what we need to do with our treatment steps.
Understood.
You can sit up. Well, yep.
So I like that. It's much different from other medical practices where they just take an MRI and say, "Oh, it looks like you have a blown disc. We have to fuse that."
Right.
As opposed to that, you're actually making sure that's the problem spot and doing stuff that's only the minimal necessary thing to help treat your patient.
Yeah. How often have you had a patient that gets referred to you because of disc pinching a nerve, and then you run through some exercises with them and the pain gets better?
All the time.
All
for
the
like
time.
decade plus. Yeah.
So it's a lot of managing pain is better diagnosis, and using live image guided examinations and diagnostic injections, we can get a lot more information than just a static MRI or X-ray that doesn't move and you can't really see it in the positions that hurt.
And it sounds like for our whiplash patients who've been suffering for
Really
years,
critical.
they
Yeah.
have to have this.
Yeah.
If you don't have this done, I can't think of anything else that's out there in
Well,
medicine that
that's-
can help them.
And that's why a lot of patients just kind of struggle in the system and they go for weeks and months and years without getting proper care. And the travesty of it is that it sets up what I call the hope and despair cycle, where somebody goes in to seek medical care with the intention of getting better. They don't get better with the treatments that have been provided, and so they start to adopt this notion that the problem is with them, that they're broken beyond repair, rather than the system is failing and not catching all the situations that could be addressed and are not being addressed.
Sounds like medicine can do better, and
That's
they're
right.
starting here at Wellward. All right, cool.
Well, that wraps up our show for today. Every individual is different. Every pain condition is different. And just as so, we honor each patient by figuring out customized treatment plans that are targeted for your issues. We encourage you to start your healing journey at wellwardmed.com. Come visit us, send us messages, send us emails. By all means, send us messages on Facebook. We do read them and respond to them, and it helps us tailor future episodes for what people need to learn more about.
Mm-hmm.
So, wellwardmed.com. I'm Dr. Danish.
And I'm Dr. Escaloni.
We'll see you next week.
Bye.
Let's see. Hey James, I'm gonna run this one more time and see if this works.